My name is Betty Wariari. I'm the Associate Director for Maternal, Newborn and Child Health at Clinton Health Access Initiative, CHAI, Kenya. I'm also part of the 2024 East Africa Leadership Thematic Journey. My project focuses on reducing the risk of preterm births by strengthening access to integrated counseling and family planning services for mothers of small and sick newborns in referral hospitals. The government of Kenya is committed towards accelerated reduction of neonatal mortality in order to achieve the Sustainable Development Goal of 12 deaths per 1,000 live births by 2030. Neonatal deaths in Kenya account for 66% of total infant deaths and 51% of all deaths in children under 5 years. Prematurity is a leading cause of neonatal mortality in Kenya, contributing to 37% of total neonatal deaths in 2023. Therefore, scaling up integrated care for mothers of small and sick newborns by creating awareness of their health risks, preventing short interpregnancy intervals, and complications such as preterm births is a priority. Every 2 seconds, a baby is born too soon. You can imagine what this means for the baby, for the mother, for the family, for the health system, and for the country at large. Therefore, we have to move beyond the care of the small and sick newborn and see how effectively we can be able to prevent preterm births. We can do this by strengthening high quality and respectful care for all women and adolescent girls, including preconception care, family planning, and antenatal care. A study on postpartum contraception of women with preterm infants in the newborn unit noted only 32% of them identified a short interpregnancy interval as a risk factor for preterm delivery. Therefore, this project was anchored on the goal of optimizing integrated counseling for mothers of small and sick newborns in order to reduce the risk of preterm births and promote access to postpartum family planning services in referral hospitals. This project was implemented by counseling mothers of small and sick newborns prior to discharge from newborn units by using an integrated checklist as a systematic guide. I was able to develop the integrated newborn unit pre-discharge checklist targeting these mothers of small and sick newborns as a systematic guide for healthcare workers to be able to use it to be able to counsel mothers on danger signs, essential newborn care, postpartum family planning and birth spacing, prevention measures. Healthcare workers were sensitized on the use of this tool. Implementation was done in 2 national referral hospitals, one with a regional newborn unit and one with a newborn intensive care unit from December 2024 to January 2025. Data was collected and analyzed, and on the screen you can see the sample of the tool that I was able to develop. The summary of the findings are as follows. 70 mothers of small and sick newborns were reached. They were counseled on various aspects. 96% of these mothers were able to select a family planning method of choice. 63% of these mothers had this family planning method of choice that they selected initiated before discharge. 37% were referred to a nearby primary healthcare facility for the services to be done post-discharge. 60% of these mothers opted for long-acting reversible contraceptives, while most of this cohort actually chose implants at 33%. 44% of mothers who opted for long-acting reversible contraceptives had this method initiated before discharge, while 56% of them were referred for the services to be done in a nearby facility post-discharge. 92% of the mothers who opted for short-acting contraceptives had this service initiated before discharge. What are we saying here? Integrating family planning counseling in the newborn units can be done. It can accelerate the uptake of postpartum contraception. It can reduce the burden of preterm births, ensure preterms have a better chance of survival, and promote maternal health. Let me quote one healthcare worker from NICU who said, access to integrated counseling and family planning services for mothers of small and sick newborns promotes the opportunity for these babies to survive and thrive. We need this tool, she said. In conclusion, reducing the risk of preterm births by integrating counseling and access to family planning services requires commitment and strong leadership. Women can be able to raise above their current challenges, soar high like an eagle, and champion impactful and sustainable strategies in preventing preterm births through family planning. The power of interdepartmental collaboration is key, and teamwork is critical in strengthening integrated quality services in referral hospitals. Integrated tools are necessary to effectively guide healthcare workers and ensure effective documentation happens and follow-up of referred cases within the health system is done. Thank you so much for your time. Please join hands with me in scaling up these life-saving interventions nationally and globally. Thank you. Thank you so much for your time.